Oh, just so we can update it,
No.
the list.
So we are.
Yeah. Okay, I'm good. Sorry. All right, hello, everyone. It is time for glasses 123. And I'd like to call the meeting to order. Keisha, would you mind taking the roll?
Absolutely, I can do that for you. Dr. Baravecchio?
Oh, sorry, here.
Mr. Bennett?
Here.
Mr. Billings?
Here.
Mr. Blunski?
Here.
Ms. Shachery? Here. Ms. Crane? Ms. Harmon? Mr. Dooley?
Here.
Mr. Macaluso? Ms. Nguyen?
No.
Here?
No, I've got one here.
Oh, yeah.
Mr. Rocca?
Here.
Ms. Stewart? Mr. Williams?
Here.
Ms. Zhu? Mr. Smith?
Here.
All right. Yeah, 10. Yeah.
Okay, thank you, Keisha. Okay, before we get started, also, can you review the rules, please?
Absolutely. Before I review the rules, I just kind of want to let everybody know we are running a little behind schedule because of our first meeting we had this morning. So we will be skipping over, going over the non-contractual agreement. Contractual, I'm sorry, guys. But it is in our status report. So you guys can review that. It's on the website. So you can look over it. So all the information that we would have reviewed today is, like I said, on the status report. All right. So now to get started with the rules for committee members and members of the public attending in person, please raise your hand to speak and wait to be recognized by the chair before speaking. To help the meeting run smoothly, please keep side conversations to a minimum and comments related to the topic we are discussing. For those committee members who are attending virtually, you must be on camera and have your first and last name showing to be counted toward our quorum. Please keep microphones muted unless called upon by the chair. Electronically raise your hand to request to speak and wait to be called on by the chair. For attendees, electronically raise your hand to request to speak. Once recognized by the chair, your microphone will be turned on. After speaking, the microphone will be returned to mute. Also, the Q&A is to only be used by those needing an ADA accommodation to participate in the meeting. Public comment will not be accepted via the Q&A, except for those individuals who request the accommodation. As for order, committee members in person and virtually will be allowed to speak first. Public members in person will be called on, followed by public participating virtually who have their hand raised. Comments in the Q&A will be addressed last. As with all hybrid meetings, it can be difficult to keep track of those waiting to speak in person and virtually, so please be patient. All comments and questions from the public may be subject to 2 minutes at the discretion of the chair. So please keep that in mind. Depending on time constraints, we may also limit comments to one per issue. Also, comments about a person's character will not be allowed. Finally, members of the public will have the opportunity to provide public comment before each vote and during designated public comment periods. The chair may also use their discretion to determine if comments will be accepted outside of those.
Okay, thank you, Rakisha. Okay, so now we are gonna have an approval of the October meeting summary. Can, everyone should have reviewed the October meeting summary, which was attached in your agenda. You received via email. There's also a copy in your committee packet. I need a motion to approve and adopt the October meeting summary. Any takers? Thank you, Tori. Tori Roca motions to accept the right to right. Tori approves Tori Roca motions to recommend we adopt the October meeting summary. Is there a second?
Second.
Elena Sashari seconds. Is there any discussion? Okay, any public comment? Okay, now we will do a roll call vote. Rakisha, can you please call the roll?
So a yes is saying that you would like to adopt the minutes. No or nay is saying that you would not like to adopt, and also you can. Dr. Bearvecchio?
Yay.
Dr. Bearvecchio, yay. Mr. Bennett?
Yes.
Mr. Bennett, yes. Mr. Billings?
Yes.
Mr. Billings, yes. Mr. Blanchfield?
Yes.
Mr. Blanchfield, yes. Ms. Sashari? Yes. Sashari, yes. Ms. Crane? Ms. Harmon?
Yes.
Ms. Harmon, yes. Mr. Dooley?
Yes.
Mr. Dooley, yes. Mr. Macaluso? Ms. Nguyen? Mr. Rocca?
Yes.
Mr. Rocca, yes. Ms. Stewart? Mr. Williams?
Yes.
Mr. Williams, yes. Ms. Zhu? Ms. Zhu, yes. Mr. Smith?
Yes.
Mr. Smith, yes. That's 11.
Okay, thank you. All right, so Bernard, will you please start us off with our non-contractual update? Okay, Mr. Williams or Brian, whatever.
I can go. Good afternoon, Gary Williams, Assistant Secretary with the Office of Aging and Adult Services. During the last meeting, I touched on that we will be entering a contractual agreement with an outside contractor to assist in addressing community choices labor weight limit. We have now done so. We have finalized the contract, fully executed a contract with a company called HCBS, Home and Community Based Strategies. They have assisted other states in addressing issues related to wait list and waiver services. So we're working with them to analyze our current wait list, as well as coming up with ways to prioritize the community choices waiver wait list. We're looking at prioritizing based upon need or acuity rather than the way way the waiver list is now set up, it's just first come, first served. So we want to look at working toward a continuum of care. As it relates to the waiver, we want to make sure that we prioritize, again, based on need, based on acuity. Others that are on the wait list, which I've touched on before, may be on a wait list for the Community Choices waiver, but they're receiving other HCBS services. So it's twofold. We want to prioritize CCW, Community Choices waiver wait list based on need acuity. And then those that are not prioritized continue to review their needs and make referrals to either long-term personal care services, LTPCS, or ADHC, which is our other waiver service, adult day health care, as well as our PACE, the program for all inclusive care of the elderly, to work toward reducing that wait list. The other thing that I wanted to make mention of was related to, I know I want to touch on this a little bit more tomorrow, of course, but I did want to let you all know we have the Community Option Waiver Fund. We say COW waiver, kind of like OCDD has the NOW waiver. We want to look at also incorporating some discussion related to that to that fund to help in advancing discussions related to a continuum of care, how we can look at some other services, how we can look at some other, maybe some cost measures that are a part of HCBS, home and community-based services, to address some of the, I guess we'll say, underlying needs when we're looking at moving this, let's say, from the nursing facilities into the community. Can any of that funding be utilized to address some of the initial costs that are associated with moving into the community? We are having some conversation with our LDH leadership about the COW fund and the language in the fund now, or in statute now, advancing home and community-based services. But we just want to make sure that everybody's on the same page with the language, and we're now examining if there needs to be some legislation surrounding that. Does it need to be a part of this upcoming legislative session to adjust language surrounding it based upon what our plans are to utilize the fund? So that's pretty much all I have for now.
Okay.
Now, I didn't know, Ben, if you wanted to get into a little bit of anything related to the budget. Not a whole lot on the budget, or you want us to have that for tomorrow?
No, you can share here, yeah.
Yeah, as far as the budget request, I think we're in a pretty good posture right now. We're still kind of going through the executive budget that was recently reviewed, discussed last Friday. But mainly as far as programmatic needs, we think we're in a pretty good posture. Some of the requested positions that we had in the budget request, we did not get at this point. Of course, it's a long process, so we'll see as the process, or once the session starts, and as it progresses along, if we'll be able to possibly get some positions, the TO that we requested, if we'll be able to get that added in as a part of the budget process. So right now, no projected cuts at this point, and so again, we'll keep you informed as once the session begins, and as it progresses, we'll provide additional information. That's all I have.
Okay. Mr. Brown and Mr.
We have a hand raised.
Oh, I'm sorry.
Ms. Melinda Elliott.
Miss Elliott, you have the floor.
I'm sorry.
Can you hear me?
Yes, ma'am.
Great. Two questions. Who is that speaking?
Mr. Williams?
Yes, Gary Williams with the Office of Aging and Adult Services.
And can you tell me a little bit more what you want to do with the Community Options Waiver Fund? Use it like individual and family supports?
just to advance home and community-based services. We no specifics at this point. The current legislation outlines exactly what the fund can be used for, but we have had discussions previously with LDH Legal about the Community Options Waiver Fund and whether the language was clear about how we could use it in concert with the Community Choices Waiver. And they previously said that we really could not use that fund to address things like I just mentioned about moving folks from nursing facilities to the community, or advancing some of the home and community-based services. Recently, our legal section looked at it and had some conversation with some stakeholders and felt like the legislation is pretty clear as it relates to utilization for home and community-based services. But we still want to make sure that it's very clear that the language in the legislation is clear about what it can be used for, and we don't have issues like we've had previously with how the language is interpreted. So we're meeting with our legal section and going to make a decision whether, okay, it's clear and we can proceed as is outlined, or if any adjustments need to be made to the language to make it clear that it's specifically for home and community-based services, and what those others, I guess, peripheral needs surrounding home and community-based services, what it could be utilized for.
Okay,
so
we're good. I just needed a little bit of clarification. Thank you.
Okay, no problem. Thank you.
Okay, thank you. Mr. Brown, will you share, Ms. Bernard Brown will share with us it's from the Department of Health regarding this current session and other initiative. Bernard, the floor is yours.
All right. Thank you, Jim. Not much by way of updates that kind of Gary didn't touch on. I know there's some hot topics that we need to kind of briefly discuss, but just to kind of give a super high level. Legislatively, the biggest thing we're probably pushing this session, you may have heard me, if you were at the summit, you may have heard us touch on it. We're looking to change OCDD's name. There will be communication going out soon. We're actually going to ask DD Council, if the actual council board members have a recommendation for potential names, if you can get those to us the next 2 weeks. I should have emailed you earlier while y'all were in executive session, but we wanted to engage stakeholders. So once we get all of the names compiled, we're probably sending out a voting tool, either through SurveyMonkey or Doodle Poll or something, where you guys can vote on the names that we identify for the potential name change. Couple of caveats. It has to start with the office, like the office of, just for consistency across LDH. Every office in LDH starts with the office of, except for Medicaid. But it's still, if you know the official name of Medicaid, it's the only bureau, right? So that's the only one. Everybody else starts with office. So that's the only caveat. And there's one other thing to consider: what the acronym looks like, right? We don't want to call it the Office for Developmental Disabilities, because when you think about the acronym, that's ODD. That's odd. So just, and there's also, that's actually, ODD is also another acronym for physical impairment or some type of medical condition. So things like that just to be mindful of. So we're excited. It's definitely happening. I know people are gonna ask why. Why is it happening? Some people felt like the name was a little outdated. Some people had issues with the use of citizen in the name, since you can't be a citizen of a state. You can be a citizen of a country. So there were a lot of little things. So the motivation behind it in part really is just to align with the trends nationally. You guys know that there's been a lot of name changes in other organizations on the national front, shifting away from some of the traditional things. So this is us doing the same. I don't know how far we're gonna deviate, but I'm optimistic to see what y'all come up with. So we'll get you the actual hard deadlines tomorrow, so you can get it to the rest of the group, and then I'll announce that tomorrow in the general session. Cool. So that's that. As far as any other legislation we're keeping an eye out on right now, there are bills starting to be pre-filed now. There's a couple that's dropping. I hadn't seen yet. Yeah, I hadn't seen, because I think this session is an unlimited amount that you can introduce. It's not a fiscal session. So we got to keep a close eye on what's coming through. But as of right now, we hadn't seen anything that poses a potential risk to our service delivery system. What else? No cuts budget-wise, no cuts in our budget. Something we would tout in the executive budget. Some money was allocated to the regional advisory committees to bolster and help build out outreach for the state advisory committee and some of the regional levels. So essentially now SACs and RACs have a budget for communication and for some other things with the intent to use that money to improve enrollment in these advisory committees. Just so the folks on the phone, like, one of my biggest things that I really want to do is really build out engagement, not just with DD Council, but with all the other entities. And the State Advisory Committee and the Regional Advisory Committees are some of the only committees that are statutorily required. And we're not utilizing that the way we need to. So our plan is to really strengthen those groups and use those groups as our core stakeholders. Some of y'all have been in long enough to know we use those core stakeholder groups to develop the processes for the most appropriate waiver, how we eliminate the wait list, the screening for urgency and need. We're going to use that SAC committee like that moving forward. Okay. So that's something that I'm excited about. So I'm excited to see how the regional advisory committees and the state advisory committees will use those funds to kind of increase participation. And then lastly, I guess this was announced, but do I need to do it? Well, this is not last. This is the thing before the last. So Julie's officially gone. I was named interim assistant secretary. Hopefully at some point in the future, I'll be able to drop the interim, become assistant secretary. But more to come on that. Let's just keep our fingers crossed. So, but for all intents and purposes with this, Julie's always going to be tethered to OCDD, but operationally, she's no longer involved in OCDD. So if you see her, or if you have access to her email, she would love an appreciation note or something, she would greatly appreciate it. And then the very last thing, I guess, I'm gonna pull the Band-Aid off. The rate study, right? The rate study is done, y'all. We got the fact sheet together. We have the memo that's going out. We have everything ready to go. We're trying to get it out the door. Really are. It's nothing nefarious going on, nothing shady going on. There's nothing in the report that's being altered or doctored. There's nothing in there that's unfavorable to the department in our eyes. It's just taking longer than we thought. Remember, we adopted three new agencies with SNAP and TDS and some of those things. So we had that happen. That kind of jumped the priority. Then the governmental shutdown, then the MCO stuff. So it's just been getting it in front of the right people to get the blessing to send it has been a little bit of a journey. But we're not hiding anything. The fiscal ask for the whole study to fund the recommendations in the study is like $53 million in SGF. We gave that number out. Anyone who asked, we provided that. The details is in the report, and that's the piece that y'all need. I get it. So we're trying really hard to get that out. It will be out before session. That's all I can say on that. Because that's all, not because I'm not allowed to say anything else. It's literally, that's all I got. So that's it for my update. If there are any questions, I'll be happy to ask.
There's a hand in the chat, Ms. Melinda Elliott.
Ms. Elliott, you have the floor.
Okay, so a couple of things. I'm really glad to hear that you're going to use the SAC and the RAC for what they were meant or they appear to be meant to be in the law. We were really disappointed when you had to leave during the last SAC meeting. It's difficult to have conversations with people that don't have all the information, people that are at the top. So I'm really glad to hear that. That's one thing. The second thing is session starts in what, 6 weeks? We're going to be waiting another 6 weeks before we get the rate study? Or did I misunderstand?
No, I'm trying to get it out ASAP. Like, I'm hoping we won't wait 6 weeks. I don't think that's the plan. I don't even think that's the intent of anyone. It's literally just nailing down the people we need to nail down to get this done and get it out the door.
So who should we concentrate on nailing down?
Me,
Can I ask that?
in all honesty, I promise y'all, I'm advocating and get an answer on this every day, y'all. Like, I really am. I don't want y'all to feel like y'all have to undertake mass emails and messaging. When it's time for that, I'll tell y'all. Right now, it's not time for that. We're there. Like, I drafted the letter a week ago. We developed the fact sheet. Brian, you saw it. Gary saw it. It's done. It's just, we just need to push the button. The snowstorm happened, so all of BMAC, all of our communications people focused on the ice storm and the deaths and stuff. It's literally just trying to get it prioritized where we can get it out. So
This has been going on since September.
I know.
I mean, the time should have been what, 3-6 months ago?
Yeah, you're right.
Okay. I appreciate you showing up and giving us good information.
Yes, ma'am. Uh-oh, yeah.
Well, I think I didn't drum because no one was first.
It was a tie.
It's like Family Feud.
Okay.
We were insane.
Yeah, we were.
Okay. Beneath.
So Bernard, my only question is the department planning to take a stance on the rate study? Are y'all supporting any legislation or are y'all supporting anything? I guess is what I'm trying to ask.
So I can share that. I got okay to share that. So it's not in the executive budget. The money for the rate increase is not in the executive budget. The governor and the administration, they went with a standstill budget. I don't know if y'all saw GLCB Friday. He said straightforward, he put out a relatively standstill budget. So that 53 million or so is not in the budget. So you guys will have to go advocate to get that added.
Will we have
Some money to work with.
Ooh. So I'll say this.
No, not the department. I'm saying there is better revenue than anticipated, which should free up some
Okay,
funds
good.
for the advocacy.
Okay, so I have a follow-up question
Yes,
to that. So if we are planning to advocate for that, when asked questions about it, I guess, are y'all in support of that? Are y'all in support of the advocacy?
Yeah, I'm telling you to go advocate. Yeah. So again, and I'm not hiding the ball. I'm not being coy. Like, we all agreed in this room and with providers that we needed an official objective rate adequacy study. The study was done. We're comfortable with how the study was conducted. We appreciate the feedback. We've been in the loop, and the recommendation is the recommendation, and it is what it is. Is that good enough for you?
Yeah.
Okay, Brendan, and the floor is yours, Brendan.
One question I had was, you had mentioned the 53 million and you said, I guess people know about that number. Who knows about it? Has it been communicated to legislators?
Yes, so everybody that asked me the number, I've given them the number. So
Gotcha.
provider associations asked, I gave them the number. You all, we talked, I gave y'all the number. I think the pain point for everybody is like, well, what does that include? Y'all can't answer that because that's all in the rate study. So I understand the frustration.
And that was part of the question of like, if someone asks you, you give it, or I guess I was more so asking, has it been sent out to legislators, the governor, whoever, as part of, creating that budget. This is how much we would need. This is why we need, because the part of the barrier is I might want to get you that money, and I would think LDH would be falling over if we're going out there trying to add for almost $55 billion. They should be excited about that, but we don't have the information to back it up. And the problem that we're running into is we meet with legislators now. A lot of them don't give you a whole lot of time when session starts because they're busy, which means I can't get them the information of why I need $53.6 million. We were here in October, it was 2 to 3 weeks.
Yep.
Now we're ice storms, we're this, we're that. But we want it done before session, and, I guess I'm maybe a little more cynical than some, but I stood out here in October when the council was deciding if that should even go on the agenda. And some of them were trying to back out of it. I'm like, no, because that rate study is going to be out, because y'all told me that thing was going to be out. And it's just kind of in a parking lot. I know who it needs to go to. We all do. And I can monitor LDH Facebook page, YouTube, and they're everywhere but inside that building. So when do we wrap it around this person or these individuals and tell them to push it out? Because that's where the barrier is. Obviously, someone at the top, and I'll be cautious because we are under LDH, someone in leadership obviously has not made this a priority. And so that's why people are starting to ask those questions. Who we're flooding emails to? Who are we putting in records requests to? Whose door are we beating down? And I think the problem is the more that this gets delayed, the angrier people are getting. And it's more so just, I like y'all, but I think y'all about to really step into some mess with some people if stuff doesn't start coming out. And I'm hoping nothing is bad or anything like that, like you said, but we can all understand why people are thinking that. And so I wouldn't be doing my job if I didn't just get out here and say it, that it needs to be pushed out. I think people have been strung along for quite some time. And it's just ridiculous that it's not out. And it's done. It's in an email ready to hit send. Why hasn't it been looked at or stamped or approved by whoever is supposed to have done that? Just doesn't. Because there will always be something. There'll be more ice storms. There'll be something else. Session will start. There'll be this happening. There'll be this fire going on. Just saying.
Cause
It's got to come out.
I do know that when whoever they said August 1st, I think I emailed Julie August 2nd. Well, I thought that's how it worked, but to Miss Melinda's point, like it's been all these months and it's, I don't wanna attack you, but there was an ice storm, were people working from home, or was that a holiday? I don't know.
Nah, Jill, Brenton, I understand the frustration. I've articulated it. I've blown the whistles, and y'all have every right to be frustrated. And that's all I got for you. Like I take pride in being a man of my word, and to this point, I haven't held up my end of the bargain. So I understand the frustration.
Okay. Brandon.
I would just recommend, as far as the council goes, if we, let's say, don't have it by next council meeting, I think you put in an invitation for secretary to attend and ask him the questions of where is this study.
If it doesn't happen by.
You have another meeting at the end of April, so
Yeah.
the session should start beginning of March.
That shouldn't be in the end of April.
I'm just saying if
So-
something comes up.
Are you saying like personal or not personal, but are you saying that it would be a deal to have it before session? Like,
Oh, yeah, no, I,
because what, yeah, like, point of saying, well, that.
oh, what I was
What
saying.
I'm saying, don't take my word for it. Essentially.
I was saying if it's not released by session, or if it's not released by the time we have our April meeting, there should be a request for the secretary to maybe answer to this council and many other advocates that are on the call, as well as provider organizations as to what's the delay. Because at this point, we're hearing there's delay. It's not the only one we haven't talked to yet, so maybe if we're still delayed by April, maybe you could tell us why.
That's,
That's all, I can't make them go. Just think, y'all could, request if it hasn't been released by me.
done. Do
Think so.
it, okay.
You can do one for good measure.
Cause I really like that recommendation to have that on record for tomorrow. So, but that doesn't mean, I don't know. Should we make an emotion? Is a motion.
As not a council member, I can't tell you to make a motion or not. That would be y'all are a committee, y'all can discuss if that is something.
Alright. Let's discuss this.
I like the idea of having it brought up tomorrow.
Okay. What does this officially mean? The emotion, cause it doesn't.
We just can it just be put in the notes that we wanted to discuss this further at the full council meeting?
Okay,
So there's a hand raised, Ms. Rhoda Elliott.
Ms. Elliott,
Yeah, nobody cares what I think, but a motion or sending it to the full council sounds like a wonderful idea. Thank you.
okay, well. Thank you, Ms. Elliott. Okay, okay, Bernard, anything else?
I think that's more than enough.
Okay, so now, Mr. Bennett, would you what is going on in your corner of the world? And I have a question when you're done.
Okay. Hey, everybody, I'm Brian Bennett with Medicaid. I think I just have one update that I want to provide with regards to legislation. Medicaid, we're working on 2 bills. They don't really directly impact home and community-based services. One allows us to work with other states to partner with them to share technology and systems. So if another state has built something really well that works, it allows us to kind of work with them and leverage it to hopefully save us money. And then another bill that we're working with is with the Office of Technology Services to kind of develop a framework to more easily develop data sharing agreements between state agencies. That's more of just kind of an administrative tool. Doesn't really impact services. I reviewed the bills that had been filed as of this morning, and I didn't see anything that directly impacted Medicaid or in particular home and community-based services. So I didn't see anything that had been filed yet but we will, like Bernard said, we'll continue to monitor that to see if anything pops up. For the upcoming budget for the fiscal year 27 request, I want to highlight two things. One is a couple months ago, you all might have heard there was a press release put out that LDH is working to align certain Medicaid rates to Medicare rates. Those mostly involve physician rates or doctor rates. Act 306 from the 2024 session required LDH to put together a plan so that the Medicaid rates for those doctor services would align with Medicare rates. So in doing that, kind of broke it up into 2 years. Earlier this year, I think this past summer, I think it was July, that was phase one of the plan where the Medicaid rate was bumped up to 85% of the Medicare rate. So in the FY27 budget, we requested additional funding to fully move it up to 100% of the Medicare rate as required by the legislation. So that was one of the big budget asks that's going to be in there for the 27 budget request, just to allow us to align the rates that we pay physicians and doctors more with the rate that Medicare pays. So hopefully that doctors and physicians will be more inclined to participate in the Medicaid program. And then one small budget request that we put in, we've seen some growth with the Act 421 program or the TEPRA program. So just on the administrative side, we put in some additional funding that allows us to, we have to pay for level of care assessments for individuals, for children that apply for that program. They have to meet institutional level of care. And most or a good bit of those have to be completed either, they either have to be completed by a registered nurse, or if they're meeting ICF level of care, it's a 90L. So we have to pay for all of that just within the administration of the program. So since we've continued to see enrollment grow within TEPRA, we included about $75,000 just to allow us to continue to fund those assessments so that we can fund the need as it's there. So I think that's all that I have that I wanted to report out for budget and legislation.
Okay, thank you, Brian. Any questions for Brian? Okay, I actually do have a comment in the question. So earlier month, my caseworker asked me if I renewed my Medicaid, and I said yes because I thought Medicaid renewals were in October, not January, but whatever, it's October, right?
So are you talking about just your renewing your Medicaid every year?
Yeah.
It's different for everybody. Everybody's renewal date is different. It depends on when you signed up for Medicaid.
Okay.
So it's not one date every year. It's just whenever you get the letter in the mail.
Okay, and then she asked me for my number, and I don't have to give that to these people, do I? I'm very grateful for all my service that I get.
Absolutely.
That being said, but I didn't, that no one, a caseworker has, no, a support coordinator has never, ever asked me that, and I don't want to give out my Medicaid number. Like, is that, you might be able to answer this, is that protocol?
So they should have access to that information already if they're your support coordinator or case manager.
Or she done?
They should be able to access that if they're linked to you as your support coordinator. So that's not something you have to provide to your.
I say no because I didn't know like what it was. It's just.
It's a long number.
On my Medicaid card, right?
Yes, but they
Okay.
should have access to that information, Jill, so they shouldn't need to ask you.
Brian, question, sorry.
Okay. Wait, hold on, 2 minutes. Never end.
So yes, as a support coordinator, like Brian's saying, we always had that information. So I never had to ask anyone for their Medicaid number.
Jill, they have the ability to log into a system and look it up if they need it.
I don't think she has that ability, friend.
Well, they should have it.
Okay. Mr. Brown, you're recognized by the chair.
Thank you, ma'am. So Brian, 2 questions. One, is there a difference between renewal and the eligibility determination, like the financial eligibility determination, or is that all one thing?
It's the same thing.
Okay.
Yeah. Now you can have with some programs, some wonky things happen, like for TEFRA, for example, sometimes your disability determination may expire at a different time as your renewal, but I think they still consider those, they'll process it with your renewal.
And the other thing is, and I think the reason why they were asking you that, Jill, was because they've been seeing a lot of people disenroll because they didn't reply to the mail that they received, asking them to renew and provide information. So maybe, not to take up for it, but maybe your support coordinator was trying to be proactive to make sure you don't get kicked off of Medicaid.
Maybe she's not that dumb after all.
Well, she should, if she's smart enough to be proactive, she should be smart enough to know she can find her information and check. But I got you. But yeah, but that's just so everybody on the phone, just if you get mail, right? If you get mail from Medicaid, please be responsive to it because.
Well, not only responsive to mail, but please make sure that if your phone number changes or you move to update that with Medicaid, because that's the only way we have to contact you. And we have the information that we have. So if a letter needs to go out, it's going to go out to the address on file. So it's very, very important that that's updated, that's kept up to date, so you can get the mail timely.
Okay. Thank you. Aiden,
I have a question. What if we can't get our mail? What if we moved and we don't have a mailbox key?
Do you have a mailing address?
I do.
Is it to, does somebody collect it at that address or?
No, I just haven't been issued a mailbox key to get my mail.
That's interesting.
Is it in an apartment?
Mm-hmm.
They should have issued you a mailbox key so you can receive mail there.
Yeah. Well, I'm one of 5, so it's a few of us that are waiting. I just don't wanna lose anything. while I'm waiting to get my mail, and then they send me another letter saying, oh, well, you didn't get your first letter, so goodbye.
Have they said why they won't give you the key? Is it,
I really don't know. There's something going on as to why they don't have the keys. It has something to do with post office. I don't have a clue. I just live there.
well, what I would recommend, if they don't give it to you soon, I would call into Medicaid and just alert them, and they can put a note in the system
Okay,
just so that they're aware that you're having that trouble
Okay.
getting that key.
I'll do
Just so
that.
they can notate that.
Okay, thank you.
Okay, then Karen. I just have one more question about the Medicaid renewal. They usually do every year, or so every year, I think around December, they reconsider the eligibility or.
Yes, it's an annual renewal, and it just varies person by person, for what time of year they send it out. It's based on your application date when you applied. That's typically, so if you applied on June the 2nd and you became eligible, your annual renewal date would be somewhere around in that area in June, early June every year.
Right, so they made any new decision, because it looks like automatically renewed, right? Just, but when if any change, they need a notice the person. And so it just looks like, I mean, just, they take a certain, they give us 30 days, or they just, because I understand, just like either receive the renewal package or something, do the application again, right? So that looks, how long, it give for how long the date time? Like 30 days, or you just?
I think it can vary, but it'll say in the letter when the response is needed.
So it looks like very fast, very quickly. I only gave it a few days, and then they just said because they due date, you didn't respond or didn't respond in time, they just directly cancel or close. So it looks like a.
And I do believe they also send out a second notice that if they haven't received what they need, that you will close on this date if you don't respond. And you can respond by mail, or you can even call them and let them know that, hey, I'm working on it, close me, but they just need some type of response by that date.
So, yeah, well, I think just when they take a renew, if they think you need a change, they may notice you, right? If you not need a change, they usually will not notice you to consider the renew application, right?
There are some people that they can renew automatically. It's called ex parte. So sometimes if we have data available to us that says, okay, this person meets, and we can verify that because we have data that shows that this is their income. So in some cases you can renew and nothing's required. They won't send out anything. So that is possible for some.
Right, I just try to understand when you renew the criteria, what kind of situation they ask you. Situation, not necessary, and they give you some type of response, right?
Yeah, I'm not sure. I know that just the Medicaid eligibility groups that qualify just solely based on income, there's no medical component to it. Those are more likely to be eligible for that automatic, or not, I don't want to say automatic, but they can use data sources that are able to confirm eligibility without sending what we call a request for information out to the individual family. But usually if there's a medical component to it, to qualify for Medicaid, we can't do those ex parte. I can talk to you more after. I think.
Okay, thank you, Ms. Karen, thank you, Brian. Okay, so that has to be our last. Can I call the question? No, that's dumb. Okay, so in the sense of, in terms of time, we have to move on to the meat of the meeting, which is this committee needs to discuss any recommendations for our 2027 planning committee. Stephanie, will you review what we need to do for the FY 27 action plan?
Sure, give me one moment. So right now I am sharing on the screen, but also in your packet is the 5-year speed plan draft. This committee is in charge of recommendations for both goal 1 and 2. So right now I have goal 1 on the screen, just that I can't get all of it on the screen or it'll be really small. So goal 1 is on the screen, and then I'll go down to goal 2 with the objectives. So you are recommending activities that are gonna fit under these objectives. And then they will go to the full council, or no, they won't, I'm sorry. Then they'll go to the planning committee to take into consideration for the annual plan. If you have any recommendations for goal 3, please hold them until the education and employment committee meeting this afternoon. But these are the goals that were the goals and objectives that were voted on at the council meeting. Whenever we voted, I don't remember. October, maybe?
October.
For the new 5-year plan.
Okay, yeah. So thank you, Stephanie. All right. So I'm not gonna read, but as stated, like y'all have in front of y'all the goals and like objectives for goals 1 and 2 for our next 5-year plan. So this committee needs to make any recommendations for specific activities for the FY 27 state plan, correct?
Correct.
So I open the floor. Wrong.
Oh. Well, there's a hand raised in the chat, Ms. Lillian.
Okay. Well, you have, you have the floor.
All right, thank you, Jill. So hi, everyone. My name is Lillian Dejean, and I am currently your Louisiana Youth Leadership Forum. This is a program the DD Council has generously funded for the past 3 years, coming on 4 now. And over the past couple years, we've seen significant program growth and expansion. We've been able to reach over 30 youth in our state. We consistently hire people with disabilities for our program, and we've really seen an amazing impact on our youth. But, you know, with costs raising, just in the world in general, right? And also with our program growth, we're looking to expand our program. And so one thing that I would ask the committee to consider recommending is an increase in funding for YLF of approximately an additional $15,000. I would be happy to answer any questions about, future plans for YLF or any questions about the program because I'm always happy to talk about camp, but I appreciate the committee's consideration.
I'm sorry, I had like shut that word down. Can you, what is your, can you repeat that price, Lillian?
I think my team and I have discussed this. I'm sorry?
Can you repeat the funding you're asking 1,500?
15K.
Okay, sorry, they help.
No, you're good. Thank you for clarifying.
Okay. And I think it's a great cause. And I love watching the program. Landon, our newest council member, is gonna be a junior councilor. And is that correct at all?
Yes, your newest council member, Brandon Hanks, was an alumni of our program in 2024. He's come back as staff in 2025, and he's actually our intern for 2026. He is an amazing rock star advocate, and he's going to be an amazing asset to the council. And I also wanted to say that Jude also was an alumni and former staff member of LAYLF. So the program is doing exactly as it was created for. We're seeing our alumni go to post-secondary programs, go on to meaningful careers, to go into these advocacy spaces where our youth voices are really, really needed. And so our hope with, additional funding is we're going to be able to expand our reach and to continue things like our internship program where we can help our alumni grow those soft job skills so then they can go on to, chase what their good life is for them. I use the verbiage your good life because that's an activity at camp. We talk to our delegates about what they want their good life to look like and how to get there.
Okay, and thank you. Okay, so once we get our ideas, we'll make a motion in second and to present it all to the full council. So tomorrow I'm reminding myself as much as all y'all. Do we have any more ideas under goals 1 and 2? To recommend for FY27 action plan, any activities to recommend to the full council tomorrow? Before I got here, I had some with their Brendan.
So y'all voted for these new 5-year plan. So I think it would be very beneficial, and since we did ask in October to come with ideas, to maybe have some input in what you would like to see happen next year. You can also request or recommend to continue if there's an activity we're currently doing that you're still very interested in. You can make recommendation to continue that, but I mean, you are the driving force, as in you and in this committee, the driving force of goals 1 and 2. we don't have an action plan unless y'all have some ideas.
I do have a suggestion because goal 2 is all about, well, health care. So I guess obviously looking is partners and then looking, well, no, so something about like, I think a good activity would be some kind of training to focus on talking to kids or to people with DD about health and exercise, because that concept is beyond me. So I think something about whether like a training or what, like just dietary, like good foods versus bad foods, like in exercises, like specific to people with disabilities, because my exercise isn't gonna be like your exercise.
Keep in mind your ideas, you may not have all the answers, it might be more conceptual, but as long as it's enough information that we can explain it well enough where we can get folks to write in there. Because what will happen is if the planning committee moves this forward and you agree that you would like this in your plan, we'll get folks to submit proposals and they'll kind of tell you, all right, for Jill's example, how can we focus on the importance of exercise, diet, wellness, general health outcomes for people? And they can write pretty much a plan for you. This is what this activity would look like. And then you'll be responsible for choosing that. So you don't have to have all your ducks in a row for what you're trying to recommend. But even if it's kind of some general ideas like what Jill has, that can get worked out on the back end before the plan actually gets started whenever we go through the proposal process. And if you have none, you have none. Really trying to make sure you capture anything you might have in it.
Okay, any more takers? Michael? Okay. So now I guess we would form a motion.
So I'm gonna share my screen to show you what I have so far, to make sure.
Okay, Brian, did you have your hand raised?
No, I didn't.
Okay. Oh, we need that increase,
All right.
like a bunch. Thank. Okay, so what this is what we have, or the two ideas we came up with. So if there's no more ideas or no more discussion, does anyone want a motion that we have these two items on our FY 27 action plan.
I am.
Ebony,
Okay, so I want to encourage everybody to look at the objectives and to maybe make some suggestions, because if these are the only two items that we send to the planning committee, they're gonna have a very difficult time trying to fill each objective with activities. So I encourage you guys to take the time now to try and maybe come up with some more ideas, because we're gonna have Lacan and Pip. All right, those are two standing ones that the council always supports and funds, YLF. But the only new thing that we're taking to the committee is the idea that you'll just, gave. And so I encourage you guys to look at objective 2 under goal 1. And that objective is specifically talking about learning about the history of disabilities. Do we have any suggestions about how we can do that? Like an activity. Again, it doesn't have to be something specific now, because the planning committee will take that over. It could be a concept that you guys have. And we can take that to the planning committee. The staff can do research on it, and we can take that to the planning committee. But I think we need to do the work in the committee today in order for us to take those recommendations to the planning committee. It'll be the same thing for the education and employment committee. We're looking for that committee to give us recommendations about activities for goal 3 that we can send to the planning committee. So this is y'all's plan. This is what y'all want to achieve in the next 5 years. So we want to make sure that we're putting the time and effort into making sure that we put activities that are going to help you guys meet your goals for the next 5 years in the plan.
okay, for his consent of firstly, then I'll take public comment, starting with Ms. River.
Sure, thank you. So this is not about goal 1 or goal 3. This is about goal 2, and I'm not sure how big of a priority people would think this is. But under objective 3, people with intellectual and developmental disabilities and their families will have access to help, tools, and supports, and when unexpected needs or issues happen. I know my organization, Disability Rights Louisiana, one of our staffers have been trying to get parish emergency response plans so we can actually put them together and figure out what they actually are. And I suspect some parishes may not have detailed plans. Others, it's kind of hard to get the plans from. I know Bambi Pluxola's group is also working on something similar to that. I think Old Dejan is working on that as well. Perhaps trying to do something where we just catalog the emergency plans of the parishes. People with disabilities know what they can expect from their parish in terms of assistance, or what type of sheltering or evacuation, or what kind of help is available in the event of a disaster. Might be a useful thing. It's again something we're working on. I have one staffer working on that, but yeah, following up with all the parishes is a bit challenging. So perhaps if the council wanted to work, and maybe they can get a better response than we can from parishes, because sometimes when my organization calls, people are worried that we're going to sue them or something like that. So and somebody who's less stacked with lawyers could be a better response. And we actually had a meeting with one of the regional emergency directors, because some of the parishes called him up and said, "Why are these people calling us, and why are they bothering us? Are they going to do something bad to us?" is the response. So we assured them we weren't, but perhaps some kind of coordinated efforts on at least beginning to find out what the plans are for the parishes with respect to people with disabilities. You can at least know and go from there to see if they need to be improved.
That is a good thought. So, okay, so, after teacher or whoever's typing it, is this kind of what you were saying,
Yeah, right. Yeah, parish emergency plans, what they currently are, if they even exist in a parish to any significant extent. I don't know if every parish really has a fleshed out plan, and what needs to be improved, and also finding a maybe creating an easy access point for people with disabilities to find out what they are. I mean, to be even on the council's website or something like that.
I see you, Miss Patty, but hold on 1 minute. Brendan,
I was gonna get clarity from Tori, but I think I got it with what he just said. I mean, so it's not necessarily this in FY 27 and FY 27 necessarily advocating for this, but it's more of an effort of compiling the plans that already exist, sort of having a database, a record of what is out there. So I see it as kind of similar to something the council funded some years ago. It was supposed to be like a disability resource website. It wasn't necessarily to create those new resources. It was to have a central location where you could find those resources instead of having to go to all these different areas.
Yeah, so
that's kind of what you're looking at.
Yeah, that and also, I mean,
Pulling it together, and then maybe in future years figuring out what area we need to.
yeah, exactly.
Gotcha.
Definitely would all be happening in a matter of months or years. Be a longish term project, because just getting the information, getting the plans in the first place will take months if we can get different people, and then cataloging that, and then looking them over to see where where they need to be improved, and getting having meetings, consensus on what needs to be improved. That would be a multi probably process.
okay, now, Elena, then since Miss Patty's a committee member, can we do Elena, Miss Patty, then Kelly?
I was gonna ask if Miss Patty could go. I don't know if she's responding in reference
Yeah.
to the same, and I'm asking a different question, just so we're not.
I was thinking the same thing, but didn't want to say this. Miss Patty, you have the floor.
Thank you so much. Patty Baravecchio with the Bureau of Family Health. Just as I'm sitting here and to Ebony's point on goal 2, part of the work of the Bureau is we work on youth health transition and have partnered with Families Helping Families on transition initiatives. So especially since this goal is focused on health, I think somewhere, maybe a partnership, maybe some trainings, I don't know, but we certainly have a lot of content expertise within the Bureau on youth health transition and how to support families through that developmental period. Additionally, as y'all were talking about, like the emergency plans and stuff and resource databases, I might point you to Exceptional Lives and some type of partnership with them. I haven't kept up with them recently, but I do know when they launched their resource in Louisiana, it was well done, an easy to use resource, and I would say funding an existing resource rather than reinventing the wheel might be helpful. But they did have someone who answered a call line if they needed that type of assistance. But there was a lot of, easy access, kind of available 24/7. You could build customized plans for your own family member. So I'm just throwing out those suggestions.
So Dr. Baravecchio, quick question. So you're saying funding the parish emergency response plan, or are you saying funding something else?
I'm saying tools for them to create plans or partnering with the parishes to put them in a kind of like a central place. Families go to Exceptional Lives for resources on for persons with disabilities. So I would say it would be a good partnership. I know LDOE has partnered with them in the past, building certain modules and stuff. So another place to link to the resources that the state is promoting or developing or has. So just coordinating things to where families can find them in the places that they're already going, kind of thing.
So does this look like what? Maybe make it a little bit smaller so you can see it. Is that what you're looking for, Dr. Patty?
Yeah, more or less partnering with other organizations to where that information is readily available. So I'm assuming that the parish emergency response plans, it's like getting that parish emergency response plan in the way I'm tracking it in my brain to the families and working with the families so that like everyone knows what needs to happen in the case of an emergency, that it gets down to the family level. And that's where something like Exceptional Lives comes. It helps them build a family plan based on what the parish emergency plan is, if that makes sense.
I think it's twofold, basically what Tori said, and then the information compiled, how do we distribute it to families so that they can use that information to create their own plans? And I think that's where the partnerships come in with organizations
Yes.
that already to get that information.
Elena?
Yeah, I have two questions.
Yes, ma'am.
This is my first time doing this. So do we need an idea for each objective, or are like the ideas, can they serve two objectives? Just trying to understand.
They can serve two objectives. You can come up with ideas for all, or if you just have one for one
There can
objective.
be more than one idea for one objective.
There can be more than one idea, yeah. Pretty much if it falls within those two goals, under any of those objectives, and then the planning committee can determine which kind of area they think it might fall under.
Okay, I just wasn't sure, because I know like HIP is one that you always fund, and so is LAYLF. I didn't know if those like were specific to a specific objective, and that I couldn't not
They would-
remembering.
Yeah, they would probably fall under one, looking at it
Okay.
now.
Because it talks about how to connect with policymakers. That's all about
Yeah,
Lacan.
it's definitely under goal one, but then probably objective one. But yeah, usually Lacan, partners, YLF, People First, those things we funded.
Yeah.
Pretty much every year, we
Okay.
continuously fund them.
Anything else?
Yeah, I like the idea of, and I don't know if this was a part of something different. I know it's come up in the past, but having some sort of not curriculum, but kind of curriculum of sorts that could be distributed for disability history that we could share with anyone who wanted to, I guess, participate. I mean, I don't know if they're doing it again, but we had a Disability Awareness Day at the Capitol. And yeah, so I don't know, I just was thinking if we could center it around that time where we would share that kind of a curriculum with anyone who wants to participate, if it be like certain schools or anything, or anyone. Even if I just wanted to do it at home with my kids. I mean, hopefully it'd be more impactful that maybe it could be shared in a school setting with classes. That would be amazing, but I also would like to just be able to share it with my own children.
All right, thank you. Kelly?
Okay, don't be mad because I know y'all are on, two. But to go back to one, I was hoping that
Oh, well, now I'm
we
mad.
could, that we could still consider, funding the training and stuff that, People First does and the training that, just to continue the funding that you guys normally do every year. But that would fall under goal one, and I know we're not on that, but I walked in late, so I'm sorry.
That's what, I mean, now I'm just like any single one and two, like, it doesn't matter. But, yeah.
And it does kind of fit, I mean, People First does get people on boards and commissions and
Right.
groups and stuff like that.
And then,
Wow.
then People First are, mandate. No.
You're not really People First, just self-advocates.
Yeah, it doesn't have a requirement for self-advocacy.
Okay. What?
And People First currently is your statewide, self-advocate network. And it's the council's advocacy. network. But People First is a statewide network for self-advocates.
Self-advocacy groups.
Oh, okay. Yeah. Okay, anything else? And again, this could be goal one or two. So that order is it like the necessity? Okay, so can you say it's great or repeat that?
Yes, ma'am.
So these are our recommendations. So now motion to recommend this for the full council tomorrow.
You want me to read out the recommendations?
I really want Amy here because it's fun. No, yes. Yes, please.
No problem. All right, the first recommendation is increase in funding for Youth Leadership Forum, Wild Up, in the amount of $15,000. The second recommendation is training to focus on talking to kids and adults with IBD on health and exercise, example, exercise, dietary recommendations, etc. The third recommendation is funding tools to create parish emergency response plan or partner with other agencies to ensure that information is available to families. Number 4 is compile parish emergency response plans and find ways to get the information out to the community. Example, what is needed and how can we improve it. Number 5, curriculum on disability history created and shared with schools and in the community. And the last one is continue funding People First trainings.
So, okay, so who wants to make a motion to recommend this to the full council? Or, okay, any second?
Second.
Okay, in second. All right, let me get back to my correct because I don't know. Okay, so. Alright. So the motion is to send this to the planning committee for the FY 20. That then action plan and we'll offer this to the full council for consideration. It was motion by Tori and seconded by Amy. Is there any discussion? Is there any public comment? Are there any objections? If no objections, okay, sorry. Teacher, can you call or roll call vote?
Not a problem. All right, Dr. Bear-Vecchio?
Yes.
Dr. Bear-Vecchio, yes. Mr. Bennett?
Yes.
Mr. Bennett, yes. Mr. Billings?
Yes.
Mr. Billings, yes. Mr. Blanchky?
Yes.
Mr. Blanchky, yes. Ms. Sassery?
Yes.
Ms. Sassery, yes. Ms. Crane? Ms. Harmon? Ms. Dooley?
Yes.
Ms. Dooley, yes. Mr. Macaluso? Ms. Nguyen? Mr. Rocca?
Yes.
Mr. Rocca, yes. Ms. Stewart? Mr. Williams?
Yes.
Mr. Williams, yes. Ms. Zhu?
Yes.
Ms. Zhu, yes. And Mr. Smith?
Yes.
Mr. Smith, yes.
Okay.
And that's 10 yeses.
Y'all, okay, the next item of agenda is the announcement. Elena, take it away.
Tell me that again.
The announcement.
Page 2, announcement in purple.
Oh, got it. Give me a second. Please note, after this meeting, our Act 378 committee meeting will be held in this room starting at 2:45, followed by the Education and Employment Committee meeting. Also, tomorrow is the full council meeting, which will start at 10 a.m. It will also be in this same room. Those that have registered to participate virtually should have the links to the meetings in their email. Does anyone on the committee have any other announcements to make?
I have something. I'm so sorry. I just thought about it. Thank you, Jill. Just think about, I know we talked about today on the recommendations, but with recommendations comes an ad hoc committee. So think about if you want to volunteer to work on that ad hoc committee for the planning committee.
That'll be too many.
It is open to any council member. Oh, ad hoc, sorry, yeah.
Not an aggregate committee, so.
Nope, it's open to anybody. Anybody can volunteer, and I think we're taking volunteers tomorrow. Is that correct? Right? I don't remember. Because we usually have that meeting before the April meeting, just so that way it can be voted on in April.
Last year, I did say a volunteer, but not the chair, and then like 3 weeks later, you called me on the chair.
I gotta do what I gotta do.
Okay. Thank you, Elena. Okay, so do we have any public comment? Okay, so, does that say 244?
256.
Close.
I hate getting my eyes. No one touches my eyes. So, I hereby adjourn the meeting at 2:56. I'll see y'all tomorrow. Thank y'all.